Start.
I was discussing about the macromotor unit, which is seen in patients of the poliomyelitis. In these patients, some of the motor nerve fibers supplying the muscle are damaged, destroyed. So, some of the muscle fibers are paralyzed. Some of the muscle fibers supplied by these motor nerve fibers are paralyzed. But some of the motor nerve fibers remain intact, remains normal. So these normal or intact nerve fibers branch to innervate the paralyzed muscle fiber. So these branch to innervate the paralyzed muscle fiber. So there is an increase in the number of muscle fibers in the motor unit. And the number of muscle fibers in a motor unit may increase up to 5 times. May increase up to 5 times in patients of poliomyelitis, and this is called macromotor unit. Macromotor unit. So this was about the motor units and then the macromotor unit. Next, we'll discuss about muscle fatigue. Muscle fatigue. Strong and prolonged muscle contraction results into muscle fatigue. Strong and prolonged muscle contraction, it results into muscle fatigue. Now what happens in muscle fatigue? The contractile and metabolic processes in the muscle fail to continue to work. The contractile and metabolic processes in the muscle fail to continue to work, and this results into muscle fatigue. In muscle fatigue, there is depletion of muscle glycogen, and accumulation of lactic acid, There is hypoglycemia. Due to depletion of liver glycogen. So hypoglycemia due to depletion of liver glycogen. Interruption in the blood supply of the muscle. Results into muscle fatigue within a few minutes. So interruption in the blood supply of the muscle for a few minutes results into muscle fatigue. Now in the experiments on nerve muscle of the frog, the site of fatigue is the neuromuscular junction. In experiments on nerve and muscle of the frogs, the site of fatigue is the neuromuscular junction. So this was about the muscle fatigue. Next we discuss about hypertrophy. Hypertrophy is increased muscle mass. So increased muscle mass is hypertrophy. Increased muscle mass is hypertrophy. Hypertrophy occurs when there is strong, regular muscle contractions. So strong, regular muscle contractions results into hypertrophy, especially if there is regular isometric exercise, especially when the regular isometric exercise, it results into muscle hypertrophy. Now in hypertrophy, muscle hypertrophy, there is no increase in the number of muscle fiber. No increase in the number of muscle fiber. But there is increase in the size of the muscle fiber. Increase in the size of the muscle fiber. Size and number of myofibrils increase. Size and number of myofibrils increase. Number of actin and myosin filaments increase. Number of actin and myosin filaments increase. So the quantity of contractile proteins increase. The quantity of contractile proteins increases. Increase quantity of myoglobin, glycogen, lipids in the muscle. So with muscle hypertrophy, increased quantity of myoglobin, glycogen, and lipids in the muscle. Right? So this was about the muscle hypertrophy. You must have seen muscle hypertrophy in bodybuilders, in weightlifters. Right? Next, I discuss about muscle atrophy. Muscle atrophy. Muscle atrophy is decrease in the muscle mass. So decrease in the muscle mass. Decrease in muscle mass. So decrease size of the muscle fiber. Decrease number of the myofibrils. Decrease number of the actin myosin filaments. So this is muscle atrophy. The muscle atrophy occurs when there is disuse of muscle. When there is disuse of muscle. Muscle is not used at all or used for weak contractions. So muscle is not used at all or used for weak muscle contraction. It results into disuse muscle atrophy. Other cause of muscle atrophy is denervation of the muscle. Denervation of the muscle. The motor nerves to the muscle are destroyed, degenerate. So motor nerve to muscle degenerate or destroyed. Now in disuse muscle atrophy, there is involvement of ATP dependent ubiquitin proteasome pathway. So in disuse muscle atrophy, there is ATP dependent ubiquitin proteasome pathway. ATP dependent ubiquitin proteasome pathway is involved in the disuse muscle atrophy. Proteasome pathway. Proteasome is a large protein which causes proteolysis. A large protein which causes proteolysis is proteasome. So proteasome pathway, it removes damaged and unneeded proteins. It removes damaged and unneeded, not required, unneeded proteins. So proteasome causes removal of the damaged and unneeded proteins. ATP dependent ubiquitin regulatory protein. Ubiquitin is a regulatory protein. It labels, it identifies. So ubiquitin is a regulatory protein. It labels or identifies which proteins are to be removed. Which proteins are to be removed. So ubiquitin is a regulatory protein which decides, which labels, which identifies which proteins are to be removed. And then the proteasome system removes the unneeded and damaged protein. So this was about the muscle atrophy. Muscle atrophy.